Hey guys, welcome to Podiatry Practice Mastery. Don here. I'm on number 13 of 20 of tips from the AAPPM meeting. So tip number 13, and I did this yesterday in the office. So I had a little child that came in. He genuinely had Achilles tendonitis, which doesn't happen that much. I tend to find it more Sever's disease on these kids, so pain to the insertion of the heel, but he had actual Achilles tendonitis pain. And when it was there, he had his little brother there. And the tip of the day is to have everyone take off their shoes when they come into the office. So this was the other tip that I got from one of the lectures, is having all the other family members in. And so this other child, he had a very flat foot, just like his brother did, and they were both going to get like a UCBL type of orthotic device. Brother's going to also get some physical therapy, things like that. But that was the other tip, is having the other sibling or parent or spouse or anyone else. What I used to do, and I'm going to try to change it, is I always ask everyone, do you have any foot problems? But I like this idea better of everyone taking off their socks and their shoes so we can see the other people's feet, because normally there's other things going on. And they don't want to bother you in terms of asking you to do stuff. So that's 13. I'm going to blend this into number 14 as well. Number 14 is going to be giving patients homework to do. I don't know if you've ever done this. I want to explain the difference. So when patients come in, I used to give a whole bunch of handouts. So I don't give handouts anymore because we use this thing called Patient Education Genius. So this is my coolest add-on to my medical record, and what it does is when I give anything out, so I can give out, let's say, those ACFAS PDFs on like Achilles tendonitis, plantar fasciitis. Those you can use the PDFs. You can just add a PDF to it if you want. I have some videos on YouTube, so I can send them a video on that specific condition they have. I can send them a ebook if I put together an ebook. You can send them someone else's website. Many times I'll send them to the Correcto's website, or there's a nice REI foam rolling video series that explains how to do foam rolling. Maybe about chi running, or any pretty much anything that you're referring them. I might send them stuff about intermittent fasting or weight loss. So anything you want, you can include in these links in Patient Education Genius. But what I think happens is that this is me, I don't know if that happens to you, but I give them stuff and I don't actually give them and tell them they should do it as homework. And so what I'm trying out, and this is what I learned about at the conference, they said, when you give people homework to do, there's an expectation that they'll do it before they come back. So what I used to do is say, I'm going to give you some stuff, but I didn't really expect them or follow up with them what they read, what they learned, what they thought, things like that. Because I tend to find, I think you do too, that the best patients are the ones that come in after binge watching a whole bunch of videos on a certain condition, or they read a whole bunch of articles on plantar fasciitis or something like that. They might be a little overwhelmed. They might not know what they need. They might come in asking if they need PRP or other types of alloplasty. Lately, that's what they're coming in for, because they're doing some type of a research. But the ones that are more educated tend to be better. And so the more stuff we can give them that's ours, the better. Okay, and the easier it is. And I think giving them the homework is the key. So anyway, those are my thoughts. I'd love to know, do you guys still do paper handouts, or do you do like some type of PDF type of handouts? I still do give them what I call the foot treatment checklist type of thing. It's a little piece of paper. It's almost like a prescription pad. And I write down things for them to do. So that's on that pad where I can tell them the type of exercises, shoes, things like that they're going to do. But anyway, I'd love to know what you guys think. And if you want to know about Patient Education Genius and all these other things, all that is inside the Practice Mastery Academy. Or you can get it over at Podiatry Practice Mastery. Okay, thanks guys. Have a good one.